Good evening. This is All India Radio. I am Saira Mujtaba, and with me is Reshma Tiwari with the evening news. The headlines. Prime Minister Narendra Modi holds meeting to review COVID-19 and vaccination situation in the country. Chief Seer of Juna Akhada ends Kumbh Mela after Prime Minister's appeal to keep it symbolic. Centre asks states to plan and increase COVID hospitals to deal with the surge in cases. More than 234,000 new cases of COVID-19 reported in the country in the last 24 hours. Price of Remdesivir injection reduced after government's intervention. Union Minister Mansukh Mandavia says Centre is assisting Maharashtra with supply of Remdesivir in every manner. DRDO to reopen its COVID hospital in Delhi Cant tomorrow. 78.36% polling recorded in fifth phase of assembly elections in West Bengal. External Affairs Minister S. Jaishankar speaks to his Afghanistan counterpart Mohammad Hanif Etmar, says India will stand with the people of Afghanistan. Raul Castro confirms handing over leadership of Cuban Communist Party to a younger generation. And in IPL cricket, Mumbai Indians take on Sunrisers Hyderabad in Chennai. As the number of COVID cases is on the rise again, we appeal to our listeners not to lower their guard, take all precautions, and all those above 45 years to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi is holding a meeting in New Delhi to review the COVID-19 and vaccination situation in the country. Top officers across various ministries are participating in the ongoing meeting. The Prime Minister had interacted with governors on the 14th of this month and chief ministers on the 8th of this month on COVID-19 situation in the country. India has achieved the landmark of administering over 12 crore doses of COVID-19 vaccine so far. The Union Health Ministry said that more than 30,04,000 doses were given to the beneficiaries in the last 24 hours. The ministry said 234,692 new cases were reported in the country in the past 24 hours, taking the cumulative positive cases to over 1 crore 45 lakhs. 1,341 deaths were also reported, taking the death toll to over 1,75,000 across the country so far. Swami Avdeshanand Acharya Mahamandaleshwar of Juna Akhada has announced an early end to the month-long mega festival Kumbh Mela for their Akhada. The announcement came after Prime Minister Narendra Modi's appeal to keep the festival as symbolic in the wake of COVID-19 pandemic. Swami Avdeshanand Giri said that the people of India and their survival is the first priority, and in view of the rising cases of COVID-19, the Juna Akhada have immersed all the deities who were installed for Kumbh. He said on behalf of Juna Akhada, it is the completion of the Kumbh. The Prime Minister spoke to Swami Avdeshanand Giri and requested that Kumbh Mela should now only be symbolic as 2 Shahi Snans have already concluded. Mr. Modi said it will strengthen the fight against the pandemic. In his telephonic conversation, the Prime Minister also inquired about the health of saints and thanked them for all kind of cooperation to the administration.
The government has said that more than 79% of new COVID-19 cases have been reported in 10 states. These states are Maharashtra, Uttar Pradesh, Delhi, Chhattisgarh, Karnataka, Madhya Pradesh, Kerala, Gujarat, Tamil Nadu and Rajasthan. The Union Health Ministry said Maharashtra has reported the highest daily new cases at 63,729. It is followed by Uttar Pradesh with over 27,000, while Delhi reported more than 19,486 new cases. The 5 states of Maharashtra, Chhattisgarh, Uttar Pradesh, Karnataka and Kerala cumulatively account for over 65% of India's total active cases. Union Health Minister Dr. Harsh Vardhan has exhorted the states to plan in advance and increase COVID hospitals, beds with oxygen supply facility and other relevant infrastructure to deal with the surge in COVID cases. He requested the states to give special focus to the prominent 5 to 6 cities in their administration, map medical colleges to either these cities or adjoining 2 to 3 districts. Dr. Vardhan chaired a high-level review meeting with the health ministers of 11 states and union territories to review measures taken by them for prevention, containment and management of the recent surge in COVID-19.
हर एक स्टेट एक अपना कोई नोडल ऑफिसर इस दृष्टि से जरूर अपॉइंट करे, क्योंकि जो जीनोम सीक्वेंसिंग के अंदर जो भी हमारे को म्यूटेशंस मान लीजिए दिखाई देते हैं, तो उनका क्लिनिकल पिक्चर और पब्लिक हेल्थ के एंगल से कोरिलेशन, इसको करने के लिए जो क्लिनिकल पिक्चर की जानकारी है वो स्टेट से वापस मिलना हमको जरूरी है। उन पर्टिकुलर केसेस में ठीक ढंग से अपने यहाँ एनालिसिस करके भविष्य के लिए प्लान करके इंफ्रास्ट्रक्चर के संदर्भ में और दूसरी चीजों के संदर्भ में।
These states include Maharashtra, Chhattisgarh, Rajasthan, Gujarat, Madhya Pradesh, Kerala, West Bengal, Delhi, Karnataka, Tamil Nadu and Uttar Pradesh. Detailing the number of beneficiaries vaccinated in each targeted segment of the population, Dr. Harshvardhan also addressed the perceived issue of vaccine shortage. He said the total consumption of vaccines so far, including wastage, has been approximately 12 crore 57 lakh 18,000 doses against the 14 crore 15 lakh doses provided by the centre to the states.
हमारे रिकॉर्ड के हिसाब से स्टेट्स के पास 1 करोड़ 58 लाख डोजेज हैं, जो कि एक हफ्ते के अंदर पाइपलाइन के अंदर सप्लाई के अंदर हैं, वो 1 करोड़ 16 लाख 84 हजार डोजेज हैं। ये फिगर देने का सिर्फ आपको आइडिया ये है कि आप सब भी इस बात से आश्वस्त रहें कि कोई वैक्सीन की शॉर्टेज नहीं है हमारे पास।
During the meeting, Dr. Vardhan also assured a fresh supply of the life-saving machines and said that 1,121 ventilators are to be given to Maharashtra, 1,700 to Uttar Pradesh, 1,500 to Jharkhand, 1,600 to Gujarat, 152 to Madhya Pradesh and 230 ventilators to Chhattisgarh. During the meeting, Union Health Secretary Rajesh Bhushan informed the states on the steps taken for providing medical-grade oxygen and augmenting remdesivir stocks in the country.
The government has stressed on providing equity in access to COVID-19 vaccines to mitigate the impact of the coronavirus pandemic. Health and Family Welfare Minister Dr. Harshvardhan urged the global community to collaborate in research and development and manufacturing of vaccines for speedy distribution to everyone across the world. The minister was sharing his views virtually at the Economic and Social Council Special Ministerial Meeting on the topic of Vaccine for All.
Equity in access to the vaccine is important for mitigating the impact of the pandemic. The disparity calls for international cooperation within the framework of COVAX and secure vaccine doses for poorest nations. We should collaborate on genomic surveillance to track virus mutations and exchange information in a timely fashion.
Highlighting the country's effort in dealing with the COVID-19 pandemic, the Health Minister said India has been at the forefront of the global fight against the pandemic. He said 2 indigenous vaccines have been granted emergency use authorization and 20 vaccine candidates are under development. He said the government is committed to providing vaccines to its citizens. Terming misinformation as a big challenge, he said vaccine hesitancy can be curtailed by providing scientific facts which will allay the fears of the public. Dr. Harshvardhan said India has made significant contributions in supplying vaccines to various vaccine alliances like Gavi and COVAX. Due to government's intervention, the price of remdesivir injection is now reduced. National Pharmaceutical Pricing Authority, in an office memorandum, said major pharma companies have announced voluntary price cuts for remdesivir injections after centre's intervention to ensure its affordable availability. Cadila Healthcare's Remdac will now cost 899 rupees instead of 2,800 rupees. Syngene International's Remwin will now cost 2,450 rupees instead of 3,950 rupees. Dr. Reddy's Redix will be available at 2,700 rupees instead of 5,400 rupees. Cipla's Ciprami will cost 3,000 rupees instead of 4,000 rupees. Mylan Pharmaceuticals Destrum will be available at 3,400 rupees instead of 4,800 rupees. Jubilant Generics JubiR will now cost 3,400 rupees instead of 4,700 rupees. Hetero Healthcare's Covey-4 will be available at 3,490 rupees instead of 5,400 rupees.
Minister of State for Chemical and Fertilizers Mansukh Mandavia has said that centre has been in active contact with officers of Maharashtra government and is assisting with supply of remdesivir in every manner. He was replying to Maharashtra Minister Nawab Malik on Twitter, who alleged that 16 export-oriented units that have 20 lakh vials of remdesivir and are seeking permission to sell it, but central government is denying it. Mr. Mandavia said the tweets by Mr. Malik are shocking. He said it is full of half-truths and lies, and the threats issued are unacceptable. The Union Minister said Mr. Malik is unaware of the ground situation. He said government is doubling the production of in the country and have given express permission to 20 more plants since 12th of this month to manufacturers. Mr. Mandavia said ensuring adequate supply of remdesivir to the people of Maharashtra remains our priority. Mr. Mandavia said centre is committed to do everything to help the people. The Maharashtra government has decided to relax the fortnightly random RT-PCR tests which was mandated for household helps, hotel and restaurant staffers, industrial workers and e-commerce delivery persons. Our Mumbai correspondent has filed this report.
Maharashtra Chief Minister Uddhav Thackeray today interacted with industry representatives through the video conferencing. He informed them that the state is facing oxygen shortage. Apart from this, industries should increase facilities for medicines, beds, testing centers and speeden up vaccination. He suggested the industries to set up such facilities by adopting a coherent working method from now on. The Chief Minister also directed the Chief Secretary to immediately form a task force of industries to work in the future in coordination with them in the field of health. Meanwhile, Chief Minister also said that industry's social responsibility would be fulfilled if they too implement initiatives like Shiva Bhojan Thali for the colonies and villages in the vicinities of their industries through CSR. Nivedita, AIR News, Mumbai.
Kerala continues to report spike in COVID cases as it confirmed 13,835 cases today. Our Thiruvananthapuram correspondent reports that over 81,000 samples were tested in the last 24 hours.
The test positivity rate rose to an alarming 17.04. Mass testing drive is going on in the state in the last 2 days as part of the state's COVID containment strategy, Crushing the Curve. State Health Minister K.K. Shailaja said that even if the number of COVID patients increases as part of the mass testing, the state is fully prepared to face the situation. She further said that presently there is no shortage of oxygen and medical facilities in Kerala and that the state had requested centre for additional 50 lakh COVID vaccine doses on priority. Meanwhile, 27 more deaths was confirmed due to COVID today, taking the death toll to 4,904. There are presently 80,019 active COVID cases in Kerala. Mayusha, AIR News, Thiruvananthapuram.
In Bihar, an all-party meeting was held today in Patna to discuss the COVID-19 situation in the state. This meeting was chaired by Governor Fagu Chauhan. Chief Minister Nitish Kumar, Deputy Chief Minister Tarkishore Prasad and representatives of LJP, Congress and left parties participated in this meeting. After the meeting, Chief Minister Nitish Kumar said political parties have expressed their views on the prevailing COVID situation. Mr. Kumar said the final decision will be taken after the meeting of Crisis Management Group, which will be held tomorrow.
मीटिंग सारे पार्टी के लोगों के साथ हो गई। गवर्नर साहब ने बुलाया था, पूरी बातचीत सब लोगों ने अपना विचार रखा है और आपको हम पहले बता चुके हैं कि आज भी इसको लेकर के उनकी क्राइसिस मैनेजमेंट का जो होता है उसके द्वारा सब देखा जाएगा और कल जो हर डिस्ट्रिक्ट के साथ बैठक हो जाएगी डीएम वगैरह के साथ और सारी जानकारी, तो कल फिर बैठक हो जाएगी और उतना करने के बाद कल फिर आपको आफ्टरनून में हम लोग आमंत्रित करेंगे और जितना कुछ भी निर्णय हुआ कल ही इसके बारे में बताएंगे हम लोग।
Meanwhile, 7,870 active cases of COVID-19 were reported in the last 24 hours in the state. Maximum of 1,898 cases were reported in Patna, followed by 610 in Gaya and 541 in Muzaffarpur.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi holds meeting to review COVID-19 and vaccination situation in the country. Chief Seer of Juna Akhada ends Kumbh Mela after Prime Minister's appeal to keep it symbolic. Centre asks states to plan and increase COVID hospitals to deal with the surge in cases. More than 234,000 new cases of COVID-19 reported in the country in last 24 hours. Price of Remdesivir injection reduced after government's intervention. Union Minister Mansukh Mandavia says Centre is assisting Maharashtra with supply of Remdesivir in every manner. DRDO to open its COVID hospital in Delhi Cant tomorrow. 78.36% polling recorded in fifth phase of assembly elections in West Bengal. External Affairs Minister S. Jaishankar speaks to his Afghanistan counterpart Muhammad Hanif Etmar, says India will stand with the people of Afghanistan. Raul Castro confirms handing over leadership of Cuban Communist Party to a younger generation. And in IPL cricket, Mumbai Indians take on Sunrisers Hyderabad in Chennai. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back. You're listening to the evening news. The Defence Research and Development Organisation, DRDO, is set to reopen its Sardar Vallabhbhai Patel COVID Hospital in Delhi Cant tomorrow. The facility was shut in the first week of February after daily COVID-19 cases came down. The 1,000-bed DRDO medical facility got 250 additional ICU beds last November to provide treatment to patients. This took the total number of ICU beds at the hospital to 500. The hospital was built by DRDO in record time of 12 days with assistance from the Armed Forces, the Ministry of Home Affairs, the Ministry of Health and Family Welfare and Tata Trust. The facility became operational in July last year. Union Health Minister Dr. Harshvardhan has spoken to Maharashtra Chief Minister Uddhav Thackeray and reassured of adequate and uninterrupted supply of medical oxygen. Dr. Vardhan also assured him all possible support with regard to healthcare infrastructure, medicines and therapeutics. In a tweet, the Health Minister said additional 1,121 ventilators are also being rushed to the state in view of the surge in COVID cases.
Delhi is under weekend curfew in view of the surge in COVID-19 cases in the national capital. It came into force from 10 p.m. yesterday. The weekend curfew will be lifted at 5 a.m. on Monday. Only essential services are exempted from the restrictions. Police pickets have been placed at various places in the city for checking of vehicles and movement of people. Earlier, a 7-hour night curfew from 10 p.m. to 5 a.m. was imposed in Delhi, which will remain there in the weekdays till 30th of this month. The Delhi police has started a helpline to facilitate the movement pass for eligible persons. The helpline number is 011-234-69900. In case of persons involved in essential services facing any difficulty or inconvenience in getting their movement passes from police authorities or seeking any clarifications, can call for assistance on this number. During the curfew, movement of persons for marriage-related gatherings up to 50 persons and funeral-related gatherings up to 20 persons will continue to be allowed. Government officials involved in emergency services like health, police, fire and emergency services as well as all other essential services is allowed on showing a valid identity card. All private medical personnel will also be allowed. Persons coming from or going to airports, railway stations and bus stations have been exempted on showing of valid tickets. Delhi Police Commissioner S.N. Srivastava visited various parts of Delhi today to take stock of the execution of weekend curfew orders. The areas toured include Akshardham, Ghazipur Crossing, Maharajpur Checkpost, NH24, Anand Vihar, Krishnanagar, New Usmanpur, Signature Bridge, Majnu Katila, ISBT Kashmiri Gate, Rajghat and Tilak Marg. In the Union Territory of Puducherry, 1,48,288 persons were inoculated so far. This includes 29,952 healthcare workers, 17,672 frontline staff and 1,664 general public. More from our Puducherry correspondent.
The spike in the coronavirus infection continues in the UT with 715 more persons tested positive for the virus, taking the tally of infection to 47,108. Presently, 721 persons are being treated in hospitals and another 3,369 positive cases are under home isolation in all the 4 regions of the Union Territory, taking the present caseload to 4,090. As many as 198 persons were discharged from the hospitals and 3 persons died. The case fatality rate in the UT is 1.50%. And the recovery rate stands at 89.82%. Chandramohan, Air News, Puducherry.
Minister of Youth Affairs and Sports, Kiran Rijiju, has tested positive for COVID-19. In a tweet, Mr. Rijiju said that after getting repeated tests for COVID-19, today his report has come out positive and he is taking the advice of the doctors. Mr. Rijiju has requested all those who have come in his contact recently to be observant, exercise self-quarantine and get themselves tested. He said he is physically fit and fine.
The Election Commission has said that 78.36% polling has been recorded in the 5th phase of Assembly elections in West Bengal held today. It said polling in 15,789 polling stations spread across 45 Assembly constituencies in West Bengal, by-election in Belgaum and Tirupati parliamentary constituencies and 12 assembly constituencies across 10 states was conducted peacefully today. The poll body said over 8,000 polling stations in West Bengal were monitored live through webcasting. It said there was a huge turnout of women voters today. The Commission thanked voters for strictly following COVID protocols. In West Bengal, barring a few sporadic incidents of violence, the election went on peacefully. The political fate of 319 candidates in 45 assembly segments spread across 6 districts is sealed in EVMs to be announced on the counting day, that is on 2nd of May. Voting was held in the 16 seats of North 24 Parganas, 8 each in Purba Bardhaman and Naudea, 7 in Jalpaiguri, 5 in Darjeeling and 1 in Kalimpong district. Prominent names in the 5th phase of election include Siliguri Mayor and Left Front leader Ashok Bhattacharya, State Ministers Gautam Dev and Brate Basu, film star turned MLA Chiranjeet, former Minister Madan Mitra and BJP's Shaumik Bhattacharya. The second wave of COVID-19 pandemic at its peak has posed a challenge to the Election Commission and the political parties to enforce COVID protocols. More from our correspondent.
Due to the pandemic, special care was taken at the polling booths. Thermal mapping of voters and offering sanitizers were seen in many booths. The security forces ensured social distancing. In some places, queues were well maintained with polling personnel allowing people one by one into the premises. The general and police observers were seen monitoring the situation. The voters, polling and security personnel were seen wearing masks, hand gloves and holding sanitizers for the voters. The polling started at 7 a.m. today and concluded at 6:30 p.m. in 12,198 polling stations across 6 districts. Sudhindra, AIR News, Kolkata.
And now we go over live to our correspondent in Darjeeling for update on today's polling in North Bengal. Manas, how did the polling go in North Bengal today, especially amid COVID and it being a sensitive region?
Well, Sarah, polling in all 3 districts of North Bengal, Darjeeling, Kalimpong and Jalpaiguri have been reported peaceful polling today. Total of 104 candidates were there and all of their political fate have been logged in EVM. Special care have been taken to ensure peaceful polling. Still, I'm in Darjeeling district right now. So let me tell you about Darjeeling. Proper security arrangement has been put in place. Accordingly, no untoward incident has been reported as informed by the district administration. All the polling booths have been guarded by the Central Armed Police Forces. Micro observers have been deployed. Half of the polling station have been covered by webcasting facilities. Apart from that, there were zonal magistrate, sector and zonal police officers kept an eye in all the poll process today. Apart from the security part, there was a concern on COVID situation. Well, in this respect also we could say all precautionary measures have been taken by the district administration to prevent the spread of contamination. All the voters have come wearing face masks. Hand sanitizers have been provided. Hand gloves were given while they were entering the polling booth. There were 3 rows for the voters, one for male, female, and the third row was for senior citizens or the PWD voters. So all measures had been taken. These same things had also been followed at Kalimpong and Jalpaiguri district administration. Back to you, Saira.
Thank you, Manas, for that update. Meanwhile, the election campaign is gaining momentum for the remaining 3 phases of assembly elections in West Bengal. Leaders of various political parties held election rallies and roadshows today. Campaigning revolved around the alleged audio tape regarding the Shitalkuchi incident throughout the day today. Senior BJP leaders, Prime Minister Narendra Modi and Home Minister Amit Shah accused the Trinamool Congress chief Mamata Banerjee of doing politics in the incident, while Trinamool Congress leader and Chief Minister Mamata Banerjee questioned the role of the central government and demanded inquiry for tapping her phone. Addressing public meetings in Asansol and Gangarampur today, Mr. Modi criticized Mamata Banerjee for non-implementation of central welfare schemes in the state, while Mr. Shah alleged that she was concerned only about her nephew instead of the people of Bengal. On the other hand, during rallies held in Purba Bardhaman district, Ms. Banerjee criticized the BJP leaders for spreading falsehood against her and TMC.
The Jharkhand High Court today granted bail to RJD President Lalu Prasad in Dumka Treasury case of the multi-crore rupees fodder scam, paving way for his release from jail. The court directed him neither to leave the country without permission nor change his address and mobile number during the bail period. Lalu's counsel has filed a bail application in the High Court saying that the RJD chief has completed half of the sentence in the case, so he should be allowed bail. The plea also cited the poor health condition of 72-year-old Prasad. The RJD Supremo has been convicted in 4 fodder scam cases. External Affairs Minister Dr. S. Jaishankar today had a telephonic conversation with Foreign Minister of Afghanistan, Muhammad Hanif Etmar, on recent developments. During the conversation, the ministers discussed the role of neighbors in the Afghan peace process. In a tweet, Dr. Jaishankar said, India will stand with the people of Afghanistan. Mr. Etmar said both discussed post-withdrawal cooperation with US and international allies and the growing partnership with neighbors and regional partners, including valued friend India. Raul Castro confirmed he was handing over the leadership of the Cuban Communist Party to a younger generation at its Congress that kicked off yesterday. The move ended 6 decades of rule by himself and older brother Fidel. He already handed over the presidency in 2018 to protege Miguel Diaz-Canel, who ran the party in 2 provinces before joining the national government. In IPL cricket, Mumbai Indians were 126 for 4 in 18 overs against Sunrisers Hyderabad at M.A. Chidambaram Stadium in Chennai when reports last came in. And now let's take a look at the weather forecast for tomorrow. National capital Delhi will have a mainly clear sky. Temperature will hover between 17 and 37 degrees Celsius. Mumbai will have a mainly clear sky. Chennai is expected to have a partly cloudy sky, while Kolkata will have a mainly clear sky. Srinagar will have a generally cloudy sky with moderate rain. Jammu will have partly cloudy sky becoming generally cloudy towards the afternoon or evening or night. Leh is expected to have overcast sky. Gilgit will have a generally cloudy sky with light rain. Muzaffarabad is also likely to have thunderstorm with rain. And now before we end the bulletin, the headlines once again. Prime Minister Modi holds meeting to review COVID-19 and vaccination situation in the country. Chief Seer of Juna Akhada ends Kumbh Mela after PM's appeal to keep it symbolic. Centre asks states to plan and increase COVID hospitals to deal with the surge in cases. More than 234,000 new cases of COVID-19 reported in the country in the last 24 hours. Price of Remdesivir injection reduced after government's intervention. Union Minister Mansukh Mandavia says Centre is assisting Maharashtra with supply of Remdesivir in every manner. DRDO to reopen its COVID hospital in Delhi can tomorrow.
78.36% polling recorded in fifth phase of assembly elections in West Bengal. Raul Castro confirms handing over leadership of Cuban Communist Party to a younger generation. And in IPL cricket, Mumbai Indians take on Sunrisers Hyderabad in Chennai. And with that, we end the evening news. Good night.